Actually, very glad that Dr. Gaston showed those last few slides because that's what makes it fun. And it's great to see everybody here. I've been charged with this, but I think I actually have the easiest assignment. PRC is the way to go for this. Let's not forget what the case is. It's a 49-year-old welder who is a former table tennis champion and probably still likes to play table tennis, right? So anyway, let's get started. Let's see. Okay. Very simple. He's 49 years old, right? Dr. Stern did his classic paper with his colleagues, looking at 22 wrists and 21 patients that had PRCs for arthritis over more than 10 years. All patients greater than 35 years old with PRC maintained a satisfactory range of motion, grip strength, pain relief, satisfied with the result. This guy, he's over 35 years old. Okay, table tennis, all right? What do you need for table tennis? You need motion. And look at this guy. I mean, this is called the backhand flick. It's a pretty common motion in table tennis. There's also a forehand flick as well. You're not going to get as much motion with any of the other procedures, especially your four-corner fusion or any kind of partial wrist fusion, as you will with a PRC. So this guy, I'm sure he still wants to play table tennis. He needs a PRC. A couple studies, Krakauer, Bishop, and Cooney from the Mayo Clinic. Compare PRC versus partial fusion procedures in 55 patients with SLAC 2 and 3 wrists. And their conclusion was that proximal carpectomy best preserves wrist mobility. Okay, so for this guy who wants to play ping pong, got to do a PRC. Here's another study from Rush. Clinical outcomes of PRC versus four-corner orthodesis, systematic review. What were their conclusions? PRCs gave better motion. Again, I keep saying ping pong. Table tennis. All right, better motion, fewer complications. And then the eminent Journal of Bone and Joint Surgery. Okay, they even looked at cost-effectiveness analysis. They did a cost-effective analysis comparing PRC versus a four-corner fusion. And what did they say? They said PRC's dominated four-corner orthodesis is the optimal strategy for stage 1 or 2 SLAC. When in the literature do we ever see the word dominated? Okay, if it says dominated in a JBJS article, you know that's the way to go. All right, so sorry, Glenn. PRC is the way to go. Boom. This is the first time, by the way, I've used an emoji in an academic lecture. Okay. Okay, Journal of Hand Surgery. This is from out of USC, Ghiasi's group. PRC versus four-corner fusion, incidence, conversion to fusion, and cost. Again, lower benefits of PRC, lower conversion to total fusion rates, lower average direct cost. All right, so overall cheaper than a four-corner fusion. Sorry, Glenn. And even our esteemed moderator, I'm not beyond kissing butt. So even Dr. Stephen J. Lee here wrote a paper on PRCs using a dermal allograft. Other people have used meniscus, some sort of interposition, if the capitate is worn or whatever. You can still do a PRC and put something in there to kind of act as a barrier between your capitate and your radius. So it's a great procedure. Another classic article from our esteemed Dr. Peter Stern, okay, proximal carpectomy, hand clinics, 2013. What did he say? PRCs, I'm sorry if I'm embarrassing you, Dr. Stern, but you're so eminent. PRCs provide painless wrist range of motion with few complications. Postoperative progressive changes at the radiocapitated articulation have been documented, yet these changes tend to remain asymptomatic, okay? So who cares, you get a little arthritis there. So in conclusion, why is PRC the way to go? It's better motion, less expensive, lower fusion conversion rates, fewer complications, and it's easier. It's easier than doing a four-corner fusion. OR time is expensive as well. You don't have to wait for a fusion to happen. It may not happen. You may get a non-union or have hardware problems. And Dr. Stern likes this procedure. I kind of think this guy looks a little bit like Dr. Osterman. What do you think? Okay. All right, thank you very much.